It's now time for us to speak with ONI Ladonette. Good morning, Oni. How are you today?
I'm fine. Good morning to you, Manda. I'm beautiful. And you?
I'm great. Thank you. So,
Yeah.
coronavirus today.
Yeah, it's always coronavirus. We have anything to talk about.
You're going to become the face of the coronavirus on STV.
No, please. No, take back that. Take it. I'm not the face.
I take it back.
Are you seeing my face? Coronavirus? No way.
By that, I mean when people see you, they immediately imagine that you're
talking about coronavirus. No. Very soon I will talk about something else.
Okay.
But for the meantime, and I have hopes that coronavirus is going to finish soon. Like this May is finishing with coronavirus.
Okay, that's only, but the WHO is saying something else altogether. Only a quick aside before you continue. When Ebola broke out in Africa, I was one of the very first persons to start reporting on Ebola. I mean, even before the media around, like I was focusing on what was happening in those countries until it became a scare and got to Nigeria. I was writing about Ebola so much that the colleagues in the newsroom and my friends were calling me Moma Ebola Manda. It did not upset me. I told myself, okay, I'm doing something right, because everyone knew that I was, carrying the fight against the Ebola virus. So do not be upset if I say you're going to become the face of the coronavirus. It means you're doing something right.
Thank you.
Okay.
Yeah, anyways, today we'll talk about the updates, and Cameroon has 1,595 recovery cases, because certain recoveries this morning, so people get to smile at home and get hopes that we're getting there. And we have over 1,992 active COVID-19 cases in Cameroon, with over 146 deaths. Now the total number of cases is over 3,733.
Wow,
that's the total number.
We are this close to 4,000.
We are this close to 4,000. The world has already 5 million.
Yeah.
So it should tell you that it's like the COVID-19 is spreading.
Yeah, and I heard something this morning on the radio. The WHO was saying the highest number of infected persons in one day was recorded, I think, yesterday or 2 days ago, or something like that. And I was like, okay, so we should not let down our guard and think that things are getting back to normal.
Nothing is getting back to normal, because the more you think that things are getting back to normal, that's the more the thing keeps spreading. Because at one point you just let down your guard and you want to hug your friend who've not seen for over 2 months, and let's just get to come together closer and everything. That's how you're transmitting the disease. Like today we're going to also talk about, because when I went to the World Health Organization page, it says most of the times not everybody shows as signs and symptoms
some
of
people
the
are
COVID-19.
asymptomatic.
Yes, so some people it doesn't show to them, but that doesn't mean they don't spread the disease. They spread the disease. So you shouldn't just be scared of those that cough around you. You shouldn't just be scared of those that have shortness of breath around you. You should be scared of everybody.
Which is why it's important to wear your mask, so that even when you're asymptomatic, you cannot spread it to other people,
and maintain 1 meter distance.
Yeah.
So we go now to Africa. Rwanda will now use a high technology robot to support the COVID-19 fight at treatment centers and minimize infection risks of the pandemic. That's beautiful, isn't it?
I'm divided about it. To be honest, I'm glad that technology-wise, it seems we're moving forward in Africa. Also, fewer medical personnel will come in contact with patients. But then I'm wondering how efficient a robot is going to be when it comes to attending to the needs of a patient. What if the patient needs something? There's the human touch that, in my opinion, the machines never really give.
Now, like these robots have the capacity to screen many people.
Okay,
that's the answer to your question, and also in a short period of time.
Now, are they just screening, or they're actually taking care of the patients
who are going forward
with the coronavirus?
Yeah, these robots also have the capacity to deliver food and medication to patients in their rooms.
Okay.
Yeah.
But doctors will still visit them.
Look at it like they do the work. They get closer to the patient, and the robots are just like intermediaries between the doctor and the patient. It transmits the information to the doctors, and they see how they can attend to the patients through the robots. Because according to the World Health Organization, over 10% of doctors around Africa, all over Africa, have died due to the COVID-19, and that's because they are the front line trying to make sure everything works out well. They're trying to make sure the patients are okay and they get to put themselves at risk. And now, not only that, this robots also would capture data, be it audio and video about the patients and every other stuff, take it down to the doctors. They see how to examine them.
Think about the poor patient dying on the bed, and there's only a robot to attend to you. You can't see your family. There's no doctor. There's no human being. It's cold.
And it also notify the officers on duty about the if it detects abnormalities in the patient.
Okay.
It will give a feedback to the doctor whether be able to attend to the patient rightly.
Okay. All right.
And it's beautiful because at one point these doctors are also family members, so they need to really protect themselves as well. So health workers being at the front line makes them vulnerable to infections. The World Health Organization has dispatched people to help health workers to train them during this period of pandemic because nobody expected that. And so it must dispatch some people to different hospitals in around Africa. They were in Kenya, they were in South Sudan to train doctors on how to take care of these patients, on how not to get too close to the patient, on how to take care of the patients in particular. You get, because during this period we're still discovering the disease because we're still learning more about the disease. We'll not tell you we know everything about the disease already. Now South Africa, Algeria, Nigeria, Ghana, Cameroon, Guinea, Senegal, Ivory Coast, the Democratic Republic of Congo, Gabon are the 10 most infected countries in Africa. So that's all we have for updates today.
Well, thank you very much, Oni.
You're welcome.
Continue with the good work.
Thank you.
And we'll see you again tomorrow?
Yeah, tomorrow.
Okay.
By God's grace.
All right. Good morning, Cameroon. Continues to be talking to Emmanuel Shiangong. But first, let's go get this spot from Viva Curfew. Don't go away.
Matama. Uba Puyuga.
Uti yule.
Mbolo. Martin Chubla. Soko biwo amba. Mena kuna ngabuki maholio. Jamna.
Agazane amyofu.
Abala. Gachi angu. Bolong.
Dari jam di koi jam madala.
Bet mo se patwaze. Meradeo.
Monsieur Songala.
Ma fin la andi lam.
Ebi muduko. Gavine ron la top.